Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Nasogastric tube placement and care. Adults. Introduction. Sometimes healthcare providers need to put a tube in a patient's nose that goes down to the stomach. This kind of tube is called a nasogastric tube or NG tube. NG tubes are usually used for short periods of time, in general not more than 30 days. NG tubes are an alternate way of providing fluids and nutrition. They can also be used to remove stomach contents called decompression. As a caregiver, you may need to insert or remove the tube at home. You will also need to check the placement of the tube before each use, flush the tube after each use, perform good skin care at least once a day, know when to call for help. This program explains how to insert and care for an NG tube at home. Placement of NG tube at home. 1. Wash your hands using soap. 2. Cut 2 pieces of tape. One piece should be small. You will use this piece to mark how far you will place the tube. The second piece of tape should be slightly larger than the other piece. You will use this tape to hold the tube in place while you check the position of the tube. 3. Starting with the end of the feeding tube, measure the distance from the tip of the patient's chin to his or her earlobe and then down to the lowest part of his or her breastbone, where the ribs come together. Add these distances together. Once you find this measurement, mark the tube with the smaller piece of tape. This tape marker will tell you how far to pass the tube. 4. Place water-soluble lubricant on the end of the tube that is going in the nose. Do not use Vaseline since it can damage the tube. 5. Gently put the tube through the nostril, pointing straight to the back of the head. If you meet resistance, twist the tube halfway and try to reinsert. Do not push the tube forcefully. The tube will first go to the back of the throat. This may make the patient gag. Drinking from a straw may help the tube to pass more quickly and decrease the gagging. Continue to gently pass the tube until you reach the tape mark on the tube. Ask the patient to swallow as you pass the tube. 6. Tape the tube down with the larger piece of tape. 7. You should check the placement of the NG tube before giving food, fluids, or medicine. When you insert a new tube. If you think the tube has come out of place. If the patient is vomiting, coughing, choking, or having trouble breathing. To check the placement of the tube, attach a syringe to the tube, pull back on the syringe, and check to see if stomach contents come up. Your healthcare provider may or may not ask you to use pH strips. These can help you tell whether the tube is in the right place. If the patient coughs a lot, has trouble breathing, or vomits, remove the tube and call a healthcare provider right away. If you don't pull up any liquid from the stomach, push the tube down 2 more inches and try again. If no liquid comes up, pull out the tube and ask your healthcare provider for help. 8. When you determine that the NG tube is in the stomach, tape the tube to keep it in place. 9. Always check the NG tube for proper position in the stomach before feedings and before giving medications. The healthcare provider can order nutrition to be given through the tube. This is to replace the food that the patient isn't able to eat. The nutrition can be given continuously or a few times a day, also called bolus feeds. Risks and complications. Inserting an NG tube is very safe. However, sometimes there are complications. You need to know about them in case they happen. You may be able to help detect them early. Minor complications include nosebleeds, a sore throat, and sinusitis. Sinusitis is the inflammation of the sinuses, which are the hollow air spaces in the bones around your nose. More serious complications include aspiration pneumonia, perforating or making a hole in the esophagus during the procedure, and collapsed lung. These extremely rare complications may require surgery. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Taking the NG tube out. When the NG tube is no longer needed, you or your healthcare provider can take off the tape that is holding the tube and then pull it out. Taking the NG tube out is not pleasant, but it is also not painful. It is faster and easier than putting it in. Flushing the tube. Flushing the tube removes liquid and nutrients stuck to the tube. You should flush the tube after every use. Wash your hands with soap and water before touching the tube. You will use clean gloves. Place warm water through the feeding syringe. If the water doesn't flow, adjust the tube placement slightly. If the water still doesn't go down the tube, you could attach the plunger and slowly push it part of the way down. Don't push too fast or push the plunger all the way down. When you are finished, place the cap back on the NG tube. Skincare. After each feeding, clean the area around the nose with a damp washcloth. Apply a little mineral oil to help soften and loosen the tape or dressing before applying a new one. Wash the mineral oil off before you apply the new dressing or tape. If the patient's nose is very irritated, you may want to switch the NG tube to the other nostril. When to call a healthcare provider. You should contact a healthcare provider if the tube falls out or if the tube gets clogged and you can't clear it. Also call if the skin around the nose becomes red, irritated, or swollen. You should call a healthcare provider right away if the patient coughs or has trouble breathing, vomits, has heartburn, feels or looks bloated. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. NG tubes are usually used for short periods of time, in general not more than 30 days. NG tubes are an alternate way of providing fluids and nutrition. They can also be used to remove stomach contents called decompression. As a caregiver, you may need to insert or remove the tube at home. You will also need to check the placement of the tube before each use, flush the tube after each use, perform good skin care at least once a day, know when to call for help. Taking the NG tube out is not pleasant, but it is also not painful. It is faster and easier than putting it in. You should contact a healthcare provider if the tube falls out or if the tube gets clogged and you can't clear it. Also call if the skin around the nose becomes red, irritated, or swollen. You should call a healthcare provider right away if the patient coughs or has trouble breathing, vomits, has heartburn, feels or looks bloated. Thank you for using Explain.